A new era is beginning for Stony Brook medicine. No great organization remains at the top of its field without a great deal of introspection and refreshed vision, and with the means to periodically renew itself. Towards that end, becoming the very best in academic medicine, based on our newly crafted strategic plan to provide the goals and milestones, based on SUNY 2020, signaling New York State's confidence that university centers are a wise investment, and based on the stupendous generosity of Marilyn and Jim Simons, the stage is now set for Stony Brook University and the School of Medicine to transform medicine by translating to the clinic our ever-increasing understanding of the scientific underpinnings of human health and disease. As a biomedical physician scientist myself, I have been continually struck by the distinctly different rates at which science and medicine advance. Science by bold leaps and bounds, medicine by incremental tiny steps. And yet we now find ourselves at an unprecedented time in the biomedical sciences, where questions of how a disease arises or why a specific symptom occurs can be answered in the laboratory. Likewise, and just as importantly, we now possess the tools to apply what we learn in the laboratory to improve the health of people. With the great opportunity that Marilyn and Jim's gift provides us, today's most innovative medical trends, such as personalized medicine, tailored therapeutics, drug discovery, and translational medicine will become common themes for Stony Brook medicine. The gift allows us to recruit brilliant new faculty, to partner with our existing biomedical leaders, fleshing out what I like to term nascent critical masses, terrific existing programs that with a couple of new investigators here or a new device there will become world-class. For example, our new chair of medicine, Dr. Vince Yang, our new cancer center director, Dr. Yusuf Hanan, and our new dean for research, Dr. Lena Obid, will undoubtedly make a huge impact on cancer medicine and cancer care delivery at Stony Brook by joining with our current outstanding faculty and staff in several School of Medicine departments and centers. And the Simons Foundation gift will catalyze our building state-of-the-art facilities in which our new and existing faculty will work. I'm especially delighted that our new biomedical research facility will be built immediately next to our new hospital expansion, the future home of Stony Brook Children's Hospital. Such adjacencies are certain to catalyze communications between scientists and clinicians, an absolute prerequisite for the successful translation of clinical insights into laboratory investigation and of laboratory discoveries into novel approaches to patient diagnosis and treatment. We have chosen to focus on several biomedical topics and to develop several innovative tools. Because cancer and neurological and cardiovascular diseases affect tens of millions of our citizens, and because our school faculty is already rich in thoughtful leaders in these biomedical topics, we have chosen to invest in these nascent critical masses of faculty and facilities with a goal of making a world-level impact on these scourges. And because imaging and information and clinical research can transform any biomedical discipline, especially cancer, neurological, and cardiovascular disorders, we have chosen to create one of the world's best intellectual and physical facilities that focuses on innovative imaging, biomedical informatics, and clinical research infrastructure. Let me illustrate the potential of this approach with but one example. If a patient comes to the emergency room with chest pain, and the nature of the patient's complaints suggest heart disease, the standard of care is to admit him or her to a coronary care unit for a couple of days to be certain the patient's not having a heart attack. With the innovative studies of one of our faculty members, Dr. Michael Poon, a negative 320 slice CT scan of the heart can allow 75% of such patients to avoid hospitalization because it can rule out coronary artery blockage with as little radiation as 2 simple chest x-rays. But what of the other patients, the ones with a positive CT scan, with plaque in their coronary arteries? Currently, neither Michael nor any cardiologist, even with the help of a coronary angiogram, can distinguish between stable plaque, that may have been there for years and that may be there without causing any trouble for another 10 years, from a plaque that's about to rupture and cause a disastrous occlusion. Simultaneous imaging with PET, or positron emission tomography, which visualizes function, and MRI, or magnetic resonance imaging, which visualizes structure, should allow this distinction. I say should because no one has yet proven the utility of such an approach. It is our hypothesis, our vision. But it is my view with the proper investment in imaging people, like Michael and our colleagues in the Department of Chemistry and at Brookhaven National Laboratories, and imaging tools like a simultaneous PET MRI, Stony Brook will be the school of medicine that removes the should. To achieve these outcomes, with the help of the generosity of Marilyn and Jim and SUNY 2020, over the next 5 years, we plan to recruit 50 basic or translational science faculty members and 50 new clinical and clinical research faculty members. Renovate approximately 90,000 square feet of space in the Health Sciences Tower to make our scientific facilities state-of-the-art and accommodate the new and existing faculty. Provide the faculty and infrastructure necessary to start a new department of biomedical informatics. Create the Stony Brook Institute for Clinical and Translational Sciences that will facilitate all aspects of clinical research. And with new classroom facilities, clinical rotations, and faculty members, to increase our medical student class size from 124 to 140 to provide more of our outstanding graduates to the physician pool of New York. Our strategic plan represents a bold vision of the elements necessary to turn the Stony Brook University School of Medicine into a world-renowned institution. Today is a day to celebrate the investments being made by New York State through SUNY 2020, and especially by Marilyn and Jim Simons. So thank you, Marilyn and Jim. The School of Medicine promises to make good on your faith in Stony Brook.